I'm Dr. Nick Neneman with Neneman Chiropractic Clinic, and thanks for joining us again for our weekly video blog. What we're going to talk about this week, it's called spondylolisthesis. It's also known as a Pars fracture. Can also be called a spondylolisthesis. And to explain what that is, the reason I decided to talk about this is I was just talking to a friend, and he was talking about his son's condition, and he referred to it as a Pars fracture, and I said, oh yeah, you know, that's also known as a spondylolisthesis or spondylolisthesis. And this seems to be a common thing I hear about, parents talking about their kids, and sometimes it can be kind of misconstrued or blown out of proportion coming from the medical side of things. You know, whether it be an MD orthopedic doctor, a lot of times they tell the patient or the parent there's a fracture. People freak out and they're telling me my back's broken, my back's cracked, or and a lot of people freak out about it. And I'm not trying to lessen what it is, but it's just this condition that we're talking about is generally not a real severe or significant issue. But to go into what it is, in the spine here we have our 3 vertebra model. There's an anatomical structure on each vertebra. It's called the pars interarticularis. And it's basically in the back part of the vertebra, and sometimes, basically, it usually always happens, in the adolescent, the growth years of children. It's not real common to have an acute pars fracture as an adult. It's generally going to happen as a child, and pretty commonly it can be a hyperextension injury, which is leaning too far back. Whether it be in an athletic activity, gymnastics, things like that. It's real common with gymnasts. But there's some sort of hyperextension and overextension, and it can either crack on the left side, the right side, or both. You can see each of those scenarios. A lot of times it is a bilateral fracture. When that pars interarticularis fractures, just the fracture in itself, and when the vertebra stays stationary, doesn't move, it's generally called a spondylolisthesis. Again, that means a pars fracture with no slippage. Now, spondylolisthesis, that's when the pars actually fractures, and then the front of the vertebra, which is called the vertebral body, it can actually slide forward. Now, generally, when that vertebra slides forward, it's most of the time stable. Again, it's nothing to freak out about. A spondylolisthesis is graded at 4 levels: a grade 1, a grade 2, grade 3, grade 4. There's actually a grade 5, which is where the vertebra actually slips off. Either the vertebra below or the tailbone below, if it's the last vertebra in the spine. Most spondylolisthesis that I ever see in my practice are a grade 1 or maybe a grade 2. That's most commonly what you'll see. And generally a grade 1 and a grade 2 is nothing to worry about. It's stable. That's the thing I emphasize to these people is, yes, it is a fracture. It's more or less a stress fracture, but it's usually stable. Of course, when it first happens in that child, they might experience some pain or discomfort, but sometimes they don't experience pain at all. A lot of people that have this pars fracture or spondylolisthesis, a lot of times they don't even know it, they don't have pain. A lot of them are asymptomatic, but in some patients they do cause pain. But again, generally most time it's stable, because even if there's some forward slippage, all the vertebrae in the spine, they're coated with thick ligaments, they're held in with ligaments, and they're generally not going anywhere. So again, grade 1, grade 2 is generally not much to worry about. Yes, it may cause some pain. And with chiropractic, you can actually get some positive results as far as pain relief with that. Generally we don't want to adjust the area where you have the spondylolisthesis, but we can adjust above and below it in those areas of the spine. You can actually get some pain relief, some more mobility. I treat people all the time with this condition, with spondylolisthesis. So now if we're talking a grade 3 or grade 4, which is further slippage, is when that vertebra is actually sliding further forward, and generally there might be some instability. The vertebra actually moves back and forth. When it comes to that with a grade 3 or grade 4, you may need a surgical consultation. Sometimes surgery is needed in real severe cases. But again, hopefully this clears up what this condition is. Again, it's pretty common. I see it all the time. When I do x-rays, I see it. I either see the fracture line or I see some forward slippage. And again, most of the time, this is a stable condition. It may be causing some pain. So if you do have a child that has lower back pain, definitely bring them in and I'll x-ray them, and we'll see if they have a spondylolisthesis. And if they do, again, we can conservatively treat it and might be able to get some good results. And again, if you have no lower back pain, you may have it too, and again, it may never cause you problems. So bring your child in, get them checked out. It's a condition we can evaluate them for. We'll plan on seeing you again next week for our video blog. Have a good rest of the week.